Let's talk to Peter Hitchens and try and get some sense out of it all. Peter, very good morning to you.
Morning.
Now, I don't know whether you've probably not seen the Sky News episode with Sadiq Khan, but this nonsense of closing schools in East London, in Greenwich in particular, that he's supporting, appears to have no commonsensical sort of reasoning behind it at all.
Well, it's very strange because right back in the summer, it was pretty much concluded, even by the most fanatical zealots for shutdown, that closing schools had been a mistake.
Yeah.
That the school children are pretty much untouched by the COVID virus, even if you think it's as serious as many people do, and I actually don't. They don't tend to suffer from it. There's been no particular evidence that they spread it either. So the closing of schools is a very worrying and retrograde step, though I do myself wonder how many schools have been quietly closed on the pretext of somebody coming in and being tested positive. I have to say again, because I am amazed, even some of my allies among lockdown skeptics are beguiled by these so-called figures of infections and the R rate and all the rest of it. What piffle this has always been. These are not people who are ill. These are people who have tested positive. And let's just assume, for the purposes of these tests are actually accurate, who've tested positive for a disease, but in most cases are showing no symptoms of it. It's described as an outbreak. An outbreak of disease is when a lot of people are ill and have to go into hospital.
Yeah.
And again, over and over again, analyses show that the numbers of people in hospital are not actually spectacularly different from the numbers which are generally in from respiratory diseases at this time of year.
No.
Once you've allowed, particularly for the growth in population and for the growth in the elderly population, they're not surprising. So it's just confected panic, and it has no purpose. And let's also go past the other thing. Every single broadcast discussion, except here, on this matter assumes that shutting down the country, shutting down London, closing businesses actually reduces the number of deaths. There remains absolutely no evidence at all that this is the case. None whatever.
No.
And if you don't assume it, and if you look at the figures, you see that there's no evidence of it. It's the whole thing is like going around the country trying to stick all the leaves back on the trees to stop autumn.
Yes.
It's a completely futile exercise in trying to prevent natural events taking place, which are normal and in most cases actually pretty harmless.
And one of the things that they've said this weekend in the Sunday Times, a Sage report, was the terrible toll of Thanksgiving in America. And again, they're doing the same thing over there as they do here. They're counting numbers and saying that things are bad in particular hospitals and numbers are up in admissions. But they say that about particular wards. For example, if you've got 10 COVID beds and you've got 10 COVID patients, you are full to bursting, which does not in any way describe the situation, does it?
Well, it may well describe a fact about a particular hospital, but that may well have been the case a year ago with influenza and pneumonia, diseases which I keep stressing seem entirely to have vanished this year and to have been miraculously cured by some measure that we know not of. People just aren't getting them anymore. But the problem in this country, and the United States obviously has separate difficulties, and each state is different. The problem in this country is that the National Health Service management over the past 20 or so years has hugely reduced the number of spare beds. So every winter, when respiratory disease is spread, particularly among the old, there is pressure on those beds. That's not a national crisis that justifies closing down the economy so that in future we'll be able to afford even fewer emergency beds in the National Health Service, which is what will, of course, happen once people realise what's happened to the economy.
Yes, and the other thing I discovered this weekend is that SAGE is made up of many different people, including quite a large number of what is called social psychologists. Now, I'm not sure what a social psychologist is, but it doesn't sound very scientific to me. And I watched one of them being interviewed on TV at the weekend, and it was all about, behavioural science and what people are likely to do if you tell them to do it, what people are likely to do if you say this and that and the other. And this is clearly what is leading government policy.
Well, it is very curious when you look at these bodies, and quite a lot of the professors who appear on television in various parts of the country telling us that we should all hide in our homes and stop working and destroy our liberty and our economy. If you look at them, they turn out not to be medical experts or even experts in experimental science, but as you say, people with the word social or psych in their supposed disciplines, which obviously means that this is not hard science, but soft science. Anything with psycho in it is soft science because it's dealing with matters of the mind on which we have no hard evidence. There's an enormous amount of pseudoscience being talked here. Whereas you get really serious people such as Sunetra Gupta and Sucharit Bhakti, whose ideas are pretty much excluded from debate. To this day, it's almost impossible to find any admission on the BBC or in much of the media of the existence of the Great Barrington Declaration. A huge number of scientists saying we were tackling this in the wrong way because the debate is never had.
No.
And I was talking to an old friend from Australia this morning, and it's quite clear that in Australia an awful lot of the things which we know here, because at least we have a more live media here than in most Anglosphere countries, things we know here are pretty much unknown over there. They're simply not discussed at all.
Well, I was told by somebody who's familiar with what happens in Australia that as soon as they get any kind of case at all, they just shut everything down again. And then they walk around saying how great it is that they've controlled the virus. But except they haven't really.
Here is the logic. It really is. We've had the Danish mask study, which showed definitively that there is no serious evidence that masks prevent the catching of the virus, and from which one might deduce it's quite unlikely that they prevent the spreading of it either. But that exists. That is the only hard science on masks. But most people don't even know it exists. And there is no hard science at all on the relationship between the shutdowns and the number of deaths. If you go, as you look at Peru and Brazil, for contrasts in South America, if you look at Japan, if you look at Korea, if you look at the major European countries, you will find no congruence between the severity of the shutdown and the number of deaths. And it's correlation, as people often tell me in another debate, is not causation, but it's often a guide to what might be causation. But you have to have it first. We haven't even got correlation in this case, which would allow us to investigate causation. There's no evidence of this, and yet it is universally assumed. You watch Newsnight, you watch anything on the BBC, everybody in any debate on this will assume that this is so. And I can't say it often enough. We have no evidence that it works at all, but we do know for certain that it has caused devastating consequences to the people suffering from other diseases in the health service. And it's also caused devastating consequences to people who are losing their jobs and whose businesses are crumbling around them because of these restrictions.
Yeah.
These are the undoubted results. We continue with this because of this extraordinary faith which some people seem to have in their political leaders. And I have no idea why anybody should have this faith at all. And if anybody had any at the beginning, back in March, they really ought to have lost it by now, and yet it continues.
Yes. Well, I mean, it will come as no surprise to you, because we'll talk about your broader assertion at the weekend about the uselessness and the lack of intelligence that appears to be abounding in Westminster in our political class. But it turns out, I was talking to a doctor this morning, Dr. Lawrence Gurlis, who wants to take part in the test and release scheme, which means that if you come back from a holiday or a business trip, you can get tested by your GP and then you can go back out into society. They have made every single GP surgery register as a laboratory in order to do this, right? He can't register as a laboratory because he doesn't have a laboratory manager, he doesn't have a laboratory staff, and he doesn't want to pay £1,800 for the privilege of being registered as a laboratory. And this is what the government is making doctors do.
Well, quite, but in any case, how many people have tried to use their GP recently? I know some people are lucky and they still have a reasonable GP service, but in a lot of cases, GP surgeries are practically inaccessible. People have to hang around in a car park to be told they can have an online consultation.
Yeah.
But the primary gatekeeping function of GPs in the National Health Service is, in many cases, more or less coming to an end. And what happens to the rest of the National Health Service? I shudder for people waiting for any kind of elective surgery at the moment. How are they going to have to wait for it? And the queues which build up now, as they build up, means more people will be joining those queues, and it will get worse. And none of this is being addressed by a government which is continually obsessed by a crisis which is more or less invented out of statistics.
That's right. And they keep warning about getting worse. And rather than actually addressing how it is, they keep telling us how much worse it's going to get. And despite the fact that it doesn't get any worse, particularly, as you've pointed out and as I've pointed out in the past, they continue with this refrain, don't they?
Well, I hereby predict that it's very likely that sometime in January we will be told that there is a third wave in progress. And you will have to examine it very hard to discover whether it exists or not. But I urge people, as with this second wave, to be very cautious about accepting at face value anything that they're told. This whole business of the proposed shutdown of London, which was resisted by ministers at the time, on the grounds that they knew that huge numbers of jobs would be destroyed by it, which would be saved if they didn't go for Tier 3. This whole business of now having another go at imposing Tier 3 on London is an illustration of the relentlessness of these panic merchants who cannot admit that they're wrong and will not give up. And I sometimes think that the campaign which I and others have been waging since March to point out this is disproportionate and a grave mistake. I sometimes think this campaign has been wholly defeated. And then I'm on my way home, I bump into maybe 5 or 6 people who say, please keep saying it.
Yes.
Maybe, just possibly, if we keep on saying it, and it does seem repetitive sometimes, if we keep on saying it, people will begin to realize that there is something going on here which really does come to an end.
Yes, and we can't not say it now, because you and I, Peter, have been doing this, although we started from perhaps opposite sides of the fence on it. You know, we're very much on the same side now, and I don't think I personally could stop saying it. I mean, I could not suddenly turn into a hypocrite overnight and say, oh, now suddenly I believe the government, you know, because something has happened that's led me to that conclusion. Because what I do know is that your consistent kind of calling out of these people as incompetent just doesn't change, but it surely must at some point. I still have faith in the system, but I don't have faith really in the government on this subject. I don't have faith in the civil service. I really don't even have faith in the NHS anymore about this.
Well, I think we are definitely approaching at some point in the not too distant future a political crisis, and it won't just be this that's led to it. I think the consequences of the mishandling of our departure from the European Union will be quite radical as well and severe, particularly in the initial months as we get used to not being in the single market anymore. I think people may be quite shocked by what happens and how much it changes their lives. I think a political crisis is coming. I suppose the only thing that people like us can say is that when it does come, that we should make sure that the case which we're making now is not forgotten, and that we should try and get into politics a superior type of person, people who actually understand how life is lived, who are genuinely knowledgeable and intelligent, rather than this ridiculous class of ambitious ex-special advisors climbing to the top out of nothing other than office politics ambition, and actually begin to have this country governed by people who love the country and care about it and know about it.
And they seem to be obsessed with the one thing that they can't attain, which is popularity. You know, they seem to be driven by the data that we keep being told, even though the data is effectively made up by people who make models every day and pretend that things might happen if you don't do something. I mean, it's almost like Alice in Wonderland time.
Well, data is fascinating, but it needs to be examined, and there's often more than one view about it, what it means. And I'm not against data by any manner of means. I hunt for it all the time, and sometimes I find data which seems to suit me, but which I say, no, that's too good to be true, and I won't take it. What we want is people in the media, and there are some, but not enough, who are prepared to examine the data in that forensic way, and not to be beguiled by the fact that it comes with a government label on it, or that it looks convincing. Everything needs to be questioned more, and that's our job. You and I are doing what the whole journalistic trade ought to be doing, questioning what we're told instead of swallowing it whole. There needs to be so much more of that, and if we've learned anything from this, is that the whole idea that we should question needs to be revived in the training of journalists and in the whole attitude of editors and news desks, that they should stop simply taking what they're told and printing or broadcasting it without examination.
Quite. What do you make of Germany right now and what they're doing? Because I was quite surprised, in one sense, that Angela Merkel seems to have now decided that all of her policies in the past didn't work, and despite the relatively low number of deaths that they are currently seeing a slight spike in, they're basically cancelling Christmas to a large extent.
Well, I've never been a huge enthusiast for Frau Merkel and her government, and I think remember that she is a child of the old East German culture, and possibly naturally as a result reaches for the bureaucratic and heavy-handed response. And I think that maybe that's it. And again, in Germany, while there has been opposition to this, in some cases quite large opposition. It's been, and this is another problem of German politics because of the nature of the major opposition party, it's been classified as right-wing extremism, and they're therefore ignored. The fascinating thing is you look at most of the continental countries which have shut down quite rigidly and have imposed muzzle wearing pretty much universally. On their own measure of cases, and indeed on the much more objective measure of deaths, so that's obviously open to interpretation as well, they aren't doing particularly well as a result of all these measures, are they?
No.
It's not as if they've escaped the consequences of the disease measured by their own standards. On the contrary.
But they've been held up, of course, as by the enemies of the government, and I don't call myself a particularly enemy of the government, just a critic of it, as one of the great sort of advantages of European modern diversity. One of the things that we were told was their test and trace system was done much better than ours, partly because they had many more private laboratories involved than we did, because ours was all very much centrally based. But I think, as you've said before, in the end, more or less every country will end up in the same boat, won't they?
Well, probably. I mean, there are differences. Some people had higher numbers of deaths earlier, and some later. But if this is quite likely, what's happening is that people of a certain age are most vulnerable, and if it didn't carry people off in the spring, it might carry them off in the autumn and so on. And I think in the end, probably when we come to examine the excess deaths, two things will become apparent. One, that while this was obviously an outbreak of a disease which killed people in exceptional numbers, it wasn't that big. And the other, that these measures didn't really have very much impact upon it. The very most they could have done, which is what we were told initially they would do, would have been to delay and displace deaths and illness rather than actually prevent it. And that was what they honestly said at the beginning. Now there seems to be this genuine belief that they can actually stop the spread of a virus by state measures. I think, as I say, that is like sending troops around the country, sticking leaves back on the trees to stop autumn. Yes. It is completely and utterly unrealistic misunderstanding of the limits on the powers of states to affect events.
Yeah, and they've also completely and utterly changed, and this will have to be the last question, I'm afraid, because we're out of time already. They seem to have completely and utterly changed their stance on the vaccine. The vaccine was going to be when everybody was going to be able to return to normal. And in fact, the vaccine doesn't stop you getting it. It doesn't stop you spreading it. And it doesn't stop you from having to self-isolate if you're told to.
Well, I mean, my view on the vaccine has been if only it makes people recover their sanity about this, then let them have it.
I'm not against the vaccine, but but it's not changing anything.
It doesn't seem to be doing that, and it has been obviously reasonably rushed. The question has to be asked whether it's been rushed too much, and whether as a result it's not going to be as effective as it needs to be to actually restore level-headedness to government and people.
Yes.
But if anything, I just pray that something will soon restore level-headedness to government and people, because if it doesn't, the losses in life, liberty, the pursuit of happiness and prosperity that we will sustain will be so great that people will be wondering 20 years hence how we got ourselves into this mess.
Exactly right. Peter, thank you very much indeed, as ever. Peter Hitchens, columnist of the Mail on Sunday, talking absolute common sense as ever, which is what we do here, because we are the home of common sense.